at the point of. But before we get to point of use, you have to understand that we do have preference card given to us a day or night before surgery, right? This preference card help us identify the trays or instruments that are needed for each of the surgeries or each of the surgical procedures. Preference card it helps us pick cases in the simplest layman term. It helps us pick cases, and that is part of our task as central service technicians, picking cases. And basically a preference card will contain patient information, date of birth, the kind of surgery that they are coming in to do. It also will contain supplies, packs. Some of the supplies may be picked by operating room, some may be picked by us. The packs usually, most of the times, is in central service department. The packs are what they will need to lay the tables. There are some basins and some sponges. Those are all disposable stuff that is critical or that is essential for the surgery. So once you get a preference card, which is received a day or night before surgery, we will follow what the preference card dictates or states that is needed for the cases. For instance, a preference card will have patient coming in the operating room for, let's say, orthopedic or total hip replacement. I'm sorry, the total hip replacement, they will tell you that they need this tray, that tray, auto 1, auto 2, auto minor, striker drill, striker saw, system set, whatever. They give you a list of trays. The trays will be in orthopedic section when it gets into the storage room. So you have the preference card. You go onto the storage room with your case card. Then you look on the section, whether the services that you are picking for is orthopedic, whether it's for ENT, whether it's for neuro, whether it's for cardiac, whether it's for general surgery. Our storage rooms is broken into sections. Every service have a rack that contains the trays that are used for those services. So it's not like you are going to struggle looking for the trays. It's not like that. It's organized. So when you get to the storage room, you can go exactly to where you need to be to pick the cases. Now, when you're picking the cases, of course, you checking off. If they need auto 1, check off, you found it. Auto minor, check off. Striker system 7 or system 8, check off. Right? Everything that you identify, you check off. And if something is missing, you communicate accordingly. If something is missing from the preference card and it is in-house tray, you can go in the tracking system, locate the tray. Locating the tray in the tracking system will tell you maybe the tray is in decontamination. It may not be in a sterile storage, but maybe in decontamination, or it may be in the sterilizer, or it may be in prep and pack. It gives you exactly location of the tray. So if a tray is needed and it's not available, you identify, you locate it, and then you tell them to process this tray because it's needed for the next day. This is the reason why we get preference card days or night before surgery, so that we make everything available for the day of surgery. If it is unavailable, then the case will be canceled. Patient will have to wait for additional hours, and of course, it leads to patients patients will not be satisfied. That's the word. Surgeons will be pissed off. Everybody will be angry, right? Because it's a waste of time, waste of money, waste of resources. So that's why we get a preference card ahead of time. And if there are any issues that we foresee, we will have to communicate ahead of time, not the day of surgery. You can't go to OR and tell them, well, you didn't receive this tray because yesterday the tray wasn't available, right? It doesn't make sense. So we always have to communicate if they don't have something that they will need. But once we identify everything, and preference card may be, depending on the cases, the number of cases that you'll be doing or the hospital will be doing in a day, which can range from 10 to 150. It all depends, or 10 to 100, right? Some hospitals are very busy. They do a lot of surgeries, so it all depends. So that said, you are picking each and every case, right? So if it is 10 procedures for tomorrow, you will be assigned in case card. You'll be picking all the 10 cases. Now, there are certain instances where trays will be unavailable because they are using the trays for the first and second cases. It happens, right? So it means that if they are using the trays for first and second cases, the third case that requires the same instrumentations may not be available because you may not have enough instrumentations. Situations like that, once the first case is done, we turn over. That is why you hear these trays are priority, these trays are turnovers, these trays are start trays. It means you have to reprocess them for the third cases. Okay, so that's important. Situations like that, it is written on the board and it becomes part of the daily huddle. The next day when we come in, hey guys, this room have 3 cases. We have to turn over the third case, the first case for the third case for room 1. Or we have to turn over the first case in room 2 for the third case because there are only 2 trays available, right? So everybody is aware, fully aware that if room 2 is done or room 1 first case is done, everything in that room must be turned over. That is why you can't forget the word turn over, you can't forget the word priority, or you can't forget the word starts is SPD. Very, very important. All right. Okay. So cases are picked. It goes up in the operating room. Operating room will perform their surgery, but before they do inspect the package for integrity. The packages ranges from wrap, rigid containers, and pill pouches. And again, they will have to make sure that the package integrity is intact. They also have to validate that the temper locks have changed color. Additionally, they want to make sure that the temper locks are intact. If this is broken and is hanging on the lock, they will not use the tray because it has to be tempered with. Okay, pill pouches definitely will have to be intact. If there is a tiny hole on it, it is not going to be used. If there's a hole on the wrap, the blue wraps, it will not be used. Okay, so there are a few things that they will have to assess before opening the trays. Also, indicators, it needs to change color to blue. It's white before sterilization. After sterilization, it changes to blue. If you look here, it's yellow. This is now sterile. So after sterilization, it's changed to black. I want you guys to understand what chemical indicators are, okay? Indicators are to prompt you whether a tray has been or an instrument has been sterilized or not. We have internal indicator and we have external indicator. We are privy to external indicators. When the trays goes to OR, the operating room staff are privy to both external and internal indicators. Why? When I'm assembling this for sterilization, I will place the internal indicator in there, right? Few bottles like this after sterilization, you can clearly see. But if the tray is in a rigid container, the internal indicator will not be seen. The only thing that we can validate is this will change from blue to black on the tray, okay? When it goes up in the OR and OR break this, OR will have to check first before they even open it. Because if it is still blue, it means the tray has not been sterilized. So once they confirm this is black and they break the seal, they will also look to see this a chemical internal indicator, which nobody can see unless they break the lid, the temper lock, open the lid of the container, and then the instrumentation will be in a basket like this with a chemical indicator. Once they identify this have changed color, they will also check the filters. The filters are usually on the metal containers, okay? Filters, we're gonna get back to that, but filters actually help prevent microbes after sterilization. There's a filter on the rigid container. That is where steam comes in and out during sterilization, okay? And this serves as a barrier. If there is a hole on this, the tray will not be used. It means that the sterility of the tray has been compromised. This also, some of them, this doesn't have any indicator, but some of them will have yellow indicator, which will change black after sterilization. These are the things the operating room will check before they will use the trays. We also have records. Central Service have the records to validate that everything has passed, right? But we don't give the records to operating room. We do not. We keep the records in our logbooks. But OR will use an internal and external indicators to confirm that stability has taken place. If stability hasn't taken place, those external and internal indicators will not change colors, okay? Because that's what they are designed for. All right, so once trays are open and the room is set, patient comes in, doctors, anesthesiologists, PA, which is physician assistant, nurse, some rooms may have 2 nurses, and a scrub tech will start the procedure, right? Doctor requests instrumentation, scrub tech or surgical technician will hand the instrumentation to the doctor. The doctor uses instrumentation. After using the instrumentation, it becomes bloody. Doctor will hand the instrumentation back to the surgical technician. Point of use care, which is a very critical component of decontamination, is done by the scrub tech wiping down the instrumentation as the surgery goes on, okay? Because once the instrument is used and it's bloody, if point of use care is not done, the blood will dry on the instrumentation, which will delay our cleaning process. It will also contribute to damage of instrumentation. It can also lead to biofilm formation, which will make this instrumentation extremely difficult. And sometimes this instrumentation can come back in operation with blood on it, depending on where the blood is heading. Okay, because if blood dries somewhere and there's a biofilm formation on, it can go through all the various processes and still have microbes present on the instrumentation. The reason why patients get infection after surgery is because of some of these things. So it is so critical point of use care is done. Okay, so our decontamination processes begin at the point of use. If you see a state board question, don't think decontamination is in central service, so the answer cannot be at the point of use. Okay, don't be confused. It begins at the point of use, which is very, very essential. The processes is very, very critical. Goal of soil item transport: prepare contaminated items so they will not be damaged after use or before return to the central service decontamination area. This is basin. This is kidney basin. This is cup, medical, this is cup. This is the tray that contains the instrumentation. Now, if you look here, the basin is filled with water during surgery. If you are picking a case card and there is basin filled with water, it needs to be drained out, it needs to be thrown out. Because you can't transport with water, it will create a spill hazard, okay? The goals of soil item transport continues to transport soil items without contaminating the environment between point of use and the decontamination area. Your goal: transport safely without cross-contamination. It is very, very important. That's why we use the case card here. This is the ideal transport, means of transport or means of transportation after instrumentation is used on patients. Very, very important. You close the door and it's metal, and you need to have that container will have a biohazard label on. You can't transport anything that has been used on the patient without biohazard label. Okay, it's a violation. It's a big violation. Somebody will think you are transporting food, and so they will be comfortable around it. They may touch something and will be. That's where cross-contamination happens, right? There are some floors like the clinics that uses fewer instrumentation. So for them, we have these bins. These are the means of transport. Small bins, they put the instrumentation in after performing point of use care. They will close it nicely, and then it's transported to central service department. You see, the container is designed with the biohazard label already on. The goals also continue to assure that all individuals who may come in contact with contaminated items remain safe during transport process. These are all the goals of transport of soiled items. Make sure that the person that is transporting is safe. We are looking at source of contamination. Where do we get contaminated items from? Mostly from the operating room, because they have a large volume of cases. And in the operating room, there are a lot of, one case may have about 15 trays. So you can imagine 15 trays for one procedure. If we have 3 of such cases, we're talking about 45 trays. So OR is the largest volume. That's why operation room is our number one customer. So our largest customer. So we are busy for OR most of the time. But yes, we still have labor and delivery to take care of. We have emergency department to take care of. We have cardiac catheterization. We have endoscopy suite. We have ENT clinics. We have podiatry clinics. We have doctors' offices and other areas that we provide services to. We have patient care equipment that are found in every area of the hospital, including ICU, labor and delivery, cardiac, even OR. Because when patients are going in for surgery, they use certain equipment, right, on them. So there's a lot more that we do. Mode of transport, we have covered transport card. The carts that we will use in transporting dirty instrumentation should be enclosed like this, okay? Case card. If you're using this to transport, it should be covered, okay? This is not an ideal means of transportation for soil instruments. This is not, it's not ideal. We don't use this for anything. We can transport sterile trays with this. It's covered nicely. We can use it to transport sterile trays, but not for soil instrumentations, okay? For soil instrumentation, this is what you'll be working with, this and that. Some of these even have a latch on it, so it locks. You lock it when you close the lid. But for the most part, the locking and everything is done by the end user. You're just going to pick and bring it to decontamination. And some of the clinics have aides that will be bringing these instrumentation to decon. All right, decon will be our favorite word for today, right? You can't forget that. Method of transport, we have lifts, we have elevators, or dump waiters dedicated to soil items transport. So it means that you may be lucky enough that your facility will have dump waiter, elevator, lifts that are dedicated for soiled items. Wednesday, I mentioned that I've worked in all these facilities that either have a dump waiter or elevator or have nothing. There are some hospitals that you will be transporting the instrumentation from OR to public elevators before you get to central service department. That is what it is. Whatever they have is what you work with, okay? And so be aware that you may not have dump waiter, you may not have a dedicated lift from OR to central service directly. But in that case, you have to use a public elevator. That's why whenever you're transporting dirty instrumentation, this is important so that if somebody is in the elevator with you, they know that this is biohazardous. Do not come and touch it, right? Or don't come and eat something on it. Put your coffee on it and all of that stuff. Hand delivery will be used for the end user department, and like the clinics, they will come in and they will hand deliver using those red bins. So the hand delivery is done with this. They will come in and drop it off. They will fill a form indicating what they are dropping off. And then you will have to sign in central service to make sure you acknowledge you're receiving all these number of instruments from this clinic, okay? All right. So when the case card comes in, you see these are the trays that you have in the case card. Some will be even more, right? Some, because the case card can take a lot of trays. User department should have dedicated holding areas to hold items until they are picked up by central service staff. Those areas should be marked with biohazard signs. Okay, the end user, labor and delivery floor, ENT floor, podiatry floor, cardiac catheterization lab, maternal fetal medicine clinic. All these clinics or all these areas, including operating room, must, is not should, they must. You can have an accredited area without having a soil utility for a procedure. If you are accredited to have a surgery or a procedure on the floor, this is part of the requirements. So if you don't have that, I don't think you will get that accreditation. Okay, you will not. You either have to change one room that you'll be using for procedure room as a soil holding. If not, you will not be accredited. So having a room in wherever procedures occur is the normal thing. You see that every hospital you go. So that when they are done, you go to the soiled utility room to pick the dirty items. And likewise, when you are bringing sterile items or clean equipment, there will be a clean holding. So it is important that all these floors have soiled room and clean room. When we are bringing sterile items up, we can't put it in the soil room. It's a violation. It's called cross-contamination. Once you bring the clean items into a dirty room, the clean automatically becomes dirty, right? You can't do that. It doesn't even make sense. Instrument decontamination begins at the point of use. I think this is a popular statement right now. Please, I am waiting. Oh, everybody's online. Everybody has been enabled in the class. Okay. Priscilla, you here? Okay, Priscilla, I just spoke with you. Okay, great. I just saw your message. I'm so sorry. And to Ophelia, I step out a little bit. That's why some of you were a little bit delayed. Okay. I'm glad everybody's on. You're all welcome. Instrument decontamination begins at the point of use. Do not forget this statement, because without this, our work will be miserable. That said, the fact of having point of use done by the operating room staff doesn't mean that we are not going to receive instrument that is dirty or bloody. Some people don't even care. Some hospitals, some technicians may know the right thing, but may not be able to do it because of time, which is not an excuse. When you are working in decon and you're getting instrumentation that is bloody, dried, and dirty, and all of that, report to your supervisor. That's the right thing to do, because whoever is doing that must be counseled or must be retrained. It is a citable offense. So either, I always say that it's either the hospital comply, do the right thing, or a joint commission surveyor will come in and cite them. Which one do you prefer? Losing your accreditation or just following the step? Okay, and it is the right thing for the patient. It's the right thing to do. Wiping down the instrumentation is the right thing to do. So this step is very, very critical. And I've explained it. Surgeon hands off instrumentation to the surgical technician, and all he needs to do is with a sterile sponge, wipe it down, get rid of the blood, because blood will be cleaned faster when it is fresh. When it dries, it becomes a pain, okay? It becomes a pain. Now, with the point of use, also, look at all these, the kidney basins, they are reusable and disposable. So when you see plastics, they are all disposable. Anything plastic during surgery is all disposable, and they come inside the pack that I mentioned, right? So if it is not disposable, then it is reusable. It becomes reusable. Yeah. It becomes reusable, and if it becomes reusable, it means it will end up in central service and we have to clean them. Don't forget, the disposable ones will have to be thrown out before it comes to us. If ever getting sponges, syringes, and all of these things in trays, somebody don't know what they're doing. We don't need all of that. We should not receive all of these sponges, syringes, needles, and no, that we don't. Only the instrumentations is what we need. Only the instruments, nothing else, nothing extra. They can keep all the extras. Just give us our instrument, that's all. Instrument or utensils, that's all. Now, the expectation after the procedure is that they put the instrumentation, after wiping it down, they need to reorganize the instrumentation back into the original tray. It doesn't matter whether they are using 50 trays or 20 trays. If this tray, this instrument came in like this, at the end of the surgery, once you are done wiping down, it needs to go back in the basket. Okay? You have to understand this is very difficult for operating room. Yes.
So are you saying that we have a central service personnel, including the team doing the surgery?
Central service personnel is not part of the team doing the surgery.
So who is the
Surgical
sponsor?
technician.
Surgical technician.
Yes, it's a different job title. They do surgical technician, basically work with
The team.
with the team in the OR.
So he's the one responsible
For the instruments.
cleaning, first cleaning, and then separation of this shaft.
Yes.
Okay.
Yes. The surgical technician responsibility is that. Cleaning, wiping out the instrumentation. But the most important part is giving the doctor the instrument when the doctors request the instruments. Nah, I won't recommend that job for anybody. They're doing well, but you'll be stuck there for forever. There's no growth. You know, some people call me and do you take the surgical technician? I said, why do you want to be surgical technician? Because you don't know. Well, you've heard it, but you really don't know. You'll be in the OR room. Some people love it, don't get me wrong. But how do you grow when your job is just that? Handling instrumentation, wiping down the instrumentation. You're always from one room to the other room. That's it. You don't see growth. You want to be in a position where you can grow. And today you're a technician, tomorrow you're a supervisor, the next day you're a manager, you're a director. That is a career. Over there, they'll say, okay, you've worked for 2 years, let's raise your pay to this. Point something, and they keep raising you. Then they give you a lead tech. What are you doing with it? So you are actually on the right foot. I'm just saying. I'm just saying. So this instrumentation will be put back in the baskets. The heavy items goes at the bottom, the lighter one stays on top. It's common sense, right? Because if you put heavy ones on delicate and sharp instruments, it will break. So all the time, heavy items, and this should go along, okay, for a long time. This is the practice. Heavy items goes at the bottom, lighter one stays on top. We'll come back to that. Sharps are separated because if you miss sharps, somebody may get themselves injured, right? Sharps are separate. They are disposable sharps that need to be thrown out. That's why we call them disposable sharps, right? Okay, this is reasons for point of use. Point of use preparation helps prolong instrument life. It helps prolong instrument life. If soil is allowed to dry on instrument, it is much more difficult to remove. These are the guidelines. Gross soil. Gross soil has to do with blood, bodily fluid, tissues, fats. Gross, when we say gross soil, that is what it means. It needs to be removed, okay? So during surgeries, that is where we get the gross soil from. Surgical technician will have to remove it. Follow manufacturer's instructions for point of use cleaning. Some manufacturer may recommend you to disassemble some parts and all of that. That is why everything we do in central service or operating room is to follow the manufacturer's instruction. Instrumentations like this, basically wipe it down with sterile water, okay? No manufacturer will tell you to wipe it down with, what do you call it? Saline solution. We do not use saline on instruments. Saline is salty and it will damage the instrumentation in no time, okay? Keep salt instrument moist. So after the instrumentation is wiped down, they still have to spray with enzymatic gel. In the past, they will use towel, soap towel, and they will spread it on the instrumentation to prevent it from drying. Some will also, like a basin like this with water, blood like this, they will leave it and fill it with water. Okay, and that creates a spill hazard. These are old techniques that is no longer, I wouldn't say no longer, some people may be doing it, it depends. But what we have now is a spray gel. Take a spray gel, after you arrange your instrumentation, they will spray on it and they will keep it moist, all right? Remove disposable components and dispose them properly. Put sharps in a sharp container. It's Wednesday, I wanted to show you a sharp container, but I will today. Okay, point of use guidelines, separate reusable liners and place in an appropriate container. Empty flutes from reusable containers. There are reusable containers like the kidney basins, like the bowl, the basin, cups, they are reusable ones. So if there are any fluid, as I mentioned previously, empty it out. Separate reusable shafts from other instruments. There are some instruments that are very sharp. They are reusable, something like this. This is reusable, but it's sharp. Look at the point. Look at the tip. It's a drill bit, very sharp. So things like that, it needs to be separated so that at least the person in central service don't get themselves injured. Keep items together. Notify central service if items need repair. This is very, very important. Operating room will have to tag some instrumentation as broken. When scissors are down, they will target down scissors. So when you get instrumentation with tags on them, it needs to be washed. Then somebody in prep and pack will take it out of service and repair, send it for repair. But when you take instruments out of service, you need to get a replacement for it, okay? All right, if the same card, when we're talking about cards, we're talking about case card. This is the same case card that we use to transport sterile trays to the operating room. It's the same case card that we use to transport dirty instrumentation to decontamination to wash. Those case cards must be washed in what we call card washer. So when you go for job interviews and they are asking you about case card washer, or do you know a car washer, and you say no, you are doing yourself a disfavor, okay? If you know a case card, that we use a case card to transport sterile instrumentation, when they ask you about case card washer and you don't know that, then I'm really sorry. You were in the class, but you're not paying attention. Case card washer is used in washing case cards. It is that simple. And it's the using that washer is the easiest thing to do. The screen, open, close, start. It's on there. Unless you don't know how to read English. The modules, the screen, everything, it's like using your cell phone. Everything is in English. Even if it is, well, of course, we don't have, you can't change that into any other language. But if you can pass the stable, then of course you can read and write English, right? So it is on there. And the case card washer is big. It's really big because the case card itself is big. And we also use a rack. That is where we wash the utensils, the basins, the kidney basins, the cups and all of that. We call them utensils. And also the metal rigid containers, the package, the rigid containers goes inside that. So we use the car washer.
Like this?
Yeah, no, this goes in the tray.
No, the top one.
The top one.
You said plastic.
Anything plastic goes in there. Unless your car washer is broken, then you have to select utensils or plastic on the main washer. There are programs on the main washer that we use to wash instrumentations. So when this is broken, sometimes you tend to that. But when your car washer is broken, you can't wash the case card because there's nothing that the case card will fit. It needs to be manually wiped down. There are some facilities that doesn't even have the car washer. So everything is done manually. There is a disinfectant wipe that they can use to clean the inner and the outer part of the case card before they use them. It disinfects, it removes all forms of microbial organisms from the case card. So car washer, the three equipment is part of the three mechanical equipment in decontamination that you must know. Okay, it is simple. Car washer is for washing case cards. I'll be disappointed if you get a question like that and you tell them no. I don't know car washer. All right, transporting, when you're transporting instrumentation from one location to the other, do that safely. Consider all used items as contaminated. There's no games in what we are doing, right? Patient comes in the hospital, they have some of their own issues, right? We don't know the issues they may have. So far as an equipment or instrument has been used on them, we don't have to play with those instrumentation. We take everything seriously. Wear appropriate personal protective equipment if you are going to handle contaminated items. Maintain control of transport carts at all times. You are in control of the car. Maintain that. Don't go and bump into people. There's going to be a lawsuit and it will be in a hot mess. Be careful when you are near to doors, elevators, and hallways and the sections where accidents may occur. Hallway mirrors can be used to reduce blind spots. Some hallways have mirrors, so before you make a turn, just look up at the mirror, make sure there's nobody coming. Always touch to the right, your far right, so that there will be a gap on the other side for people to also walk. Right? Don't be in the middle where everybody will have to wait for you to pass, these are just some basic things you need to know. Everyone who has contact with contaminated items must understand the dangers associated with transport of biohazard items. In conclusion, point of use instrument preparation requires partnership between central service and user department. Good work practice can protect patient visitors and healthcare workers. This is an important statement. Any questions? Point of use. Any question? Any question? Any questions? Let me see if I can. Yes, go ahead with your question.
Does every tray has its count?
Yes, every tray have its count.
So the technician in there will make sure the count is accurate before he send it to the contact area.
Ideally, that is how it's supposed to be. So we actually follow the count sheet to make sure everything is in the tray. When you get to the operating room, they count after what we did. So on the count sheet, they have central service count. When they say they need, like, this is a coca, one on the tray, and you say, okay, I found one, check. Operating room will have to validate that they have one. They check all the instrumentation and make sure they have one. Let's say mosquito 4, you check, you found all 4. Operating room will have to check that they have, indeed, there are 4 mosquitoes. Because at the end of the day, they don't want to leave instruments inside the patient. That's why they will count after you. But sometimes central service staff makes a lot of mistakes. If you make a mistake, it's held against you. You'll be trained, but if you keep on making the same mistake, then it will lead to progressive discipline. Why do you say 5 when you only have 4? It means either you don't know what you're doing, or you just put every instrumentation back. Later on, you come to understand that when they are putting the instrumentation back in the OR after the surgeries, they don't put everything back as they should. So there are instances where you get instrumentation missing in SPD. There are instances where you get a tray with a lot of instrument that does not belong, because they open multiple trays for surgery. Nobody, unless they've been doing it for a long time, they mostly don't know that this belongs to that tray. A lot of people don't know that. So that's why we do inspection and assembly. You are inspecting the instrumentations, but you're also making sure everything that is missing is present. And if there are any extra items you are removing, okay, this understanding is very, very essential. Because if you are interviewing and you are discussing preparation and packaging, and you are speaking as I'm speaking, someone says, this guy is an expert, we want him to be on our team, right? So there are certain keywords or some understanding, in-depth understanding that if you have, it tells whoever is interviewing you that you are really good, okay? Because it's not a lot of people that will know that. But we'll get there, and we're going to cross the bridge when we get there. But I lost my username at this point. If you've not registered Sterile University, I can't stress on how important it is. Go to sterileuniversity.com, create an account. When you create an account, there are countless videos that you can be watching before you even finish this class. Before you go for any job interview, you've already watched everything you need to know, okay? So you go to resources, you go to equipment in services. Every equipment we use in central service, every sterilizer is right there. Let me minimize this. Let's go. Oh, yeah, it's a little bit slow. Let's see. See, these are all the different types of sterilizers. We have the sterile. This is low temperature sterilizers. We've not done that. This is endoscope drying and storage cabinets, a video you can watch. Okay, this is the System 1 Endo in-service training. So this is endoscopy. This is chemical sterilization. This is V-Pro, sterile. Still low temperature sterilizing. You just need one video when it comes to, if something is multiple, you need like one. We've not done sterilization, so I will not even worry you on that. But we'll get there eventually, but I'm just letting you know what resources we have. This is the car washer. Vision 1321 cut and utensils washer. So you can actually watch a video ahead of time. And then you understand everything about the car washer. It's right there. Free resources. You don't have to pay, not even a dime. Right? So if you are reading decontamination, and I teach you some of the equipment we have in Decon, and you come here, you can watch videos on the equipment to support the lecture. Okay. These are ultrasonic cleaners. We'll be talking about them. There are videos on all the different, you just need one, because the understanding is the same. This is a washer disinfector. Definitely, we're going to talk about that. There's a video on washer disinfector. This is a pre-cleanse that we use at the point of use. This is what we're talking about, point of use processing gel. This is a gel. You don't even have to waste your time. It's a gel, just spray on it. You don't need a video. It's little to know, right? But I'm just letting you know that everything that we use in the department is on this website. Sterile is a manufacturer. They actually design the equipment we use in every central service department. There are other companies, but those other companies don't have videos like this. You understand? So you need this. See, look at this. The washer disinfector, a whole video. I mean, I don't know if we have enough time, but we'll probably watch some of them. Stabilizers and all of that. So the three equipment we have in Decon is right there. If you go under resources, if you go under equipment in services, watch a video on ultrasonic cleaner, cat washer, automated washer disinfector. That is everything in Decon you need to know. Apart from the temperature of the decontamination room must be negative, air pressure, decontamination must have eye wash sink. The eye wash sink must be checked every week to make sure it's functioning properly. Because when something spills on your eye, you need to wash or rinse off your eye. So if you don't check to make sure the eye wash sink is working well, what will happen? What will happen is when you get yourself injured, there's no sink to rinse your eye off. It is important you rinse your eye off 15 minutes whenever something goes on your eye. By that time, every disease will be removed before you go to ED to assess yourself. Okay, so eye wash sink is a must that anywhere we deal with chemicals, there must be an eye wash sink. It's a requirement. So you have one in decontamination. Make sure you do your test. All you need to do is turn the eye wash on, let it come out. It's like two holes that comes out like this. And it needs to come at a certain level because you don't want to put your head in the basin because the pressure is coming too low. So you assess the pressure, assess the cleanliness of the eye wash. Okay, pretty simple stuff. It is in the book. Okay, it's in the book. Give me 1 second. Let me. Okay, let me send this. So we've learned everything about point of use care, and now we are going to talk about decontamination. What do we do there, right? That's the next thing we're going to do. But I want to share some pictures on decontamination, and we can all take it from there. Decontamination. So I'm gonna just go through some pictures with you quickly, and we will take it from. So I brought you here just to point out some few things to you. Also, I want us to watch a video. A video will summarize the point of use care. So you can watch a journey of surgical instrumentation, and it will take you through everything that we'll be talking about in this class. On the same website, there is high-level disinfection, how to handle endoscopes, and everything is right there. There's a video on that. So, okay.
Before the instrument goes to decontam, the more the efficiency of the reprocessing cycle will be maintained, and we are fulfilling our role in instrument care and protection. So pre-treatment, again, it's just not just a nice idea or something that sterile processing kind of pushes for, right? Our operating room guidelines support the use of these products as well. Both AST, which is the Association of Surgical Technologists, and AORN, which is the Association of Perioperative Registered Nurses, have language that supports point of use pretreatment prior to sending to sterile processing. So AST states, unless indicated otherwise by the manufacturer's directions for use or the IFU instructions for use, the CST should immediately immerse instruments in a basin of sterile water at the end of the procedure. Biofilm that adheres to the instrument surfaces is difficult to remove if allowed to dry. Organic debris that is kept moist prevents the buildup of biofilm. So again, before we put that in the cart to send.
So there's a video that talks about point of use care, but there's another one that I want us to watch. We have a lot of things to talk about, so I don't want to. Let's watch this video.
STERIS e-learning modules are easy-to-use web-based training programs. These virtual training lessons will provide you with practical situations and scenarios. Throughout this series of training modules, you'll be asked to perform a variety of actions. Here are some of the common actions you'll be asked to perform. Green text indicates discovery learning points, which may be displayed when you roll your cursor over the text. These discovery learning points are called rollovers. Blue text indicates glossary information to be revealed by clicking on the glossary text. Noteworthy icons will occur periodically when there is noteworthy additional detail. You can click on the noteworthy icon to reveal more details. Are you ready? Let's get started.
Hi, I'm Richard Schul, Director of Clinical Education at Sterile, and today I'd like to welcome you to this module, a surgical instrument journey within healthcare. This module provides a fundamental knowledge of the daily process a surgical instrument goes through to provide safe outcomes for the hospital's patients and staff. As a former Central Service Department manager, I understand the importance of these outcomes and how critical the skill and talent of an educated staff impacts this journey. As you review this module, you will explore the different environments and processes a surgical instrument must pass through to complete its journey. Our journey will begin in the operating room and complete in the Central Service Department. Within the Central Service Department, the instrument will pass through areas such as decontamination, preparation and packaging, sterilization, and sterile storage. Let's get started.
Network is slow. I'm sorry. I don't know why, but it's very, very slow.
Hi, I'm Richard Schul, Director of Clinical Education at Sterile, and today I'd like to welcome you to this module, a surgical instrument journey within healthcare. This module provides a fundamental knowledge of the daily process a surgical instrument goes through to provide safe outcomes for the hospital's patients and staff. As a former Central Service Department manager, I understand the importance of these outcomes and how critical the skill and talent of an educated staff impacts this journey. As you review this module, you will explore the different environments and processes a surgical instrument must pass through to complete its journey. Our journey will begin in the operating room and complete in the Central Service Department. Within the Central Service Department, the instrument will pass through areas such as decontamination, preparation and packaging, sterilization, and sterile storage. Let's get started.
We'll begin our surgical instruments journey within the operating room. The operating room is a dynamic and fast-paced environment in which patient surgical procedures occur. It provides the surgeon and staff with the tools and equipment necessary to perform a variety of surgical procedures. Procedures that occur in this environment must adhere to stringent infection prevention and safety guidelines for both the patient and staff's well-being. The handling and care of the surgical instrument within the OR is an important part of these processes. Surgical instruments must pass through a cleaning and sterilization process before they can be used. Compromising these guidelines could cause a serious infection within the patient that may result in a lengthened hospital stay, or even worse, death. Within this topic, you'll learn more about the care and use of surgical instruments in the OR, including how the operating room personnel receive and handle surgical instruments, methods for gathering and pre-treating instruments at the end of a surgical procedure, and common methods for sending instruments back to the Central Service Department. With this in mind, it's important for the instruments to be ready for the procedure before it begins. Let's take a closer look at how this happens.
So we can tell who is the surgical technician here, right? If you look at this picture,
Mhm.
the surgical technician is this lady.
The lady who she got the instrument.
Yes. And this is the surgeon. This may be a PA, a physician assistant, maybe a nurse. Patient is right there, making incision, and all the good stuff.
So that surgical technician, it comes from your department.
No.
No, you have their own department.
The hemostat. It's one of the most commonly used stainless steel instruments found in a set of instruments within the OR. The instrument sets are assembled in the preparation and packaging area of the Central Service Department, which we'll discuss later in this module. These sets are organized and assembled based on the specific surgical procedure which they're intended for. Before a surgical procedure begins, a case cart will arrive in the OR from the Central Service Department with the instrument sets and supplies needed for the surgical procedure. Once the sets arrive in the OR, they are inspected for package integrity and that all external chemical indicators have turned appropriately, indicating the set has been exposed to the sterilization process. The surgical instruments are then removed from a wrapped tray, rigid container, or peel pouch using aseptic technique. During the removal of the instruments, the surgical team member will retrieve and read a chemical indicator that must be present in each set. If parameters were met during the sterilization of the instruments, the indicator will have turned color, indicating that the instruments are safe to use in the procedure.
All right, so we've already mentioned that, right?
During the surgical procedure, care of the instruments should be maintained in order to begin the cleaning and decontamination process following the procedure. At the end of the surgical procedure, the instruments must be gathered and prepared for the journey back to the Central Service Department. This is known as point of use preparation. It ensures that gross soils are properly treated before they leave the OR. If the soils are not immediately treated, potential damage to the instrument may occur, or soils may dry on the instruments, making it more difficult to remove during the cleaning process in decontamination. Delicate and sharp instruments should be separated to prevent damage to instruments and injury to employees. Point of use treatment on non-lumen surgical instruments may be prepared in a few different ways by the OR staff. These can include placing the instruments in a basin or tray with a damp towel placed over the instruments, placing them in a container with an enzymatic solution or water to soak, or applying a transportation gel, which eliminates the need for a soaking solution. The last option is becoming a more popular method because submerging the instruments in water can potentially create a spill hazard during transport. Also, unlike the damp cloth method, the transportation gel thoroughly contacts gross soils on the instrument.
So we are clear, right? You've seen the spray gel. This is how they spray their instrumentations before it is transported to Central Service.
After point of use preparation of the instruments has occurred, it will be necessary to transport them back to the Central Service Department for decontamination. Most transportation devices consist of an enclosed cart in which the basins or trays containing the soiled instruments are transported. Closed carts minimize the potential risk of cross-contamination to staff during transport. Amy recommends transport carts be identified as biohazard when transporting soiled items. The carts are rolled to an elevator that will descend to the lower level of the hospital. Traditionally, this is where the Central Service Department is located in the hospital.
Right, so you saw the rigid container also. The container in the case card, that's the rigid container. Inside that is a basket with instruments. Okay, so.
As the journey of the surgical instrument ends in the OR, you learn several concepts, including how the OR receives and handles instrumentation. You also learn what happens at the conclusion of a procedure and how the instruments are gathered and prepped for decontamination. Lastly, you discover the common method for the transportation of the instruments to decontamination.
The rigid container, right? Just want everybody to be aware of the packages that we have, the 3 types of packages. The metal container is this one. I don't want to come back again and you don't know what rigid container is.
We can see.
It's right on the screen. It's right on the screen. This is a rigid container. This is a rigid container. Inside the rigid container is this basket. So there are three types of packages we have. We have that rigid container, which houses baskets like this with instruments. We have blue wrap. It could be a basket, it could be a plastic, but it's wrapped in blue. This is a blue wrap. Okay? They use it to wrap the trays. And few pouches. Three types of package. We'll talk about that when we are doing inspection and assembly, but I just want you to have a better picture of what we are dealing with. This is the only thing we have in central service, nothing else. So it's important you know all three of them. Okay.
So the rigid container, are they always metal?
They are always metal. That's why we call it rigid. Okay. That's why we call it rigid. It's always metal. All right. And don't forget the metal container.
Let's continue our journey.
Is what
Now,
happens.
our soil instruments have been gathered and placed into a case cart.
On both
The cart
sides.
can be transported to the central service department and the area of decontamination. Let's see what happens next. The next stop for our instrument will be the area of central service, specifically decontamination. Soiled instruments, such as our hemostat, are delivered from the OR to be cleaned of any gross soils in decontamination. This is a critical step in the journey of the instrument because without the instrument being fully cleaned, it cannot be sterilized. Thorough cleaning removes the majority of all microbes on the instruments. Cleaning also renders the instrument safe to handle by the technicians. Within this topic, you'll learn when manual cleaning is used and how it is accomplished, how mechanical cleaning is accomplished and its benefits, and what mechanical cleaning equipment can be found in decontamination and how it works.
So before we proceed, you come to realize this late, I don't know when it's a lady or a guy, he took something liner from the tray.
Mhm.
It's a plastic liner. It's different from this. It's almost, it serves the same purpose, but that is a reusable liner. The white liner that is underneath this basket will have to be thrown out. It's disposable, but there are some liners that are reusable. Okay, so I want you to understand that. When you get a tray that have a liner must be thrown out. But if you can get something like this in decontamination, you can put this in the water like you can soak the whole thing in the water like that. Make sure you throw it out. But the best way to handle instruments in decontamination, of course, before we get there, I just want to make sure you are leaving no stone unturned. On a daily basis, you have a huddle, you know exactly where you'll be working every single day. So the person who will be assigned to decon, obviously, will have to put on your personal protective equipment. It is very, very critical part. You need to know this because even when you go for job interviews and you're discussing decontamination, walk me through decontamination, and you start decontamination, well, I'll take my instrumentation, I'll soak it, I wash it, and it doesn't add up. You can't start instrumentation without wearing your PPE. That's the first basic step, right? Because it's a requirement, you want to start from there. Well, before I start my day in decontamination, I wash my hands, I put on my personal protective equipment, I get my case card. Case card, we know case card. What will be in the case card?
Soil items.
Soil items. I get my case card with soil items. Now, I mentioned something called priority. For instance, if you get a tray, case card with 20 items, are you going to wash, just wash because you have 20, 30 items in front of you? Or you identify among the 20 trays you have in the case card, which is priority. You have to understand these ideas so that when you're speaking, you speak like someone who have 10 years of experience. So I'm teaching you like somebody who have 10 years of experience, right? I have 10, so you have 20 trays. First of all, when I put on my personal protective equipment, I get my case card from OR. Of course, the case card may be there because you can't wear PPE and walk to OR, right? You wear PPE when you're about to work on the instruments. When I open the case card, first of all, I will identify the priority tray. I'll identify what is priority because you will have a huddle and your supervisor will say, oh, well, you need this, we need this tray today, we need that, we need that. So you know. So when you get a case card, you are identifying if any of the priorities are in the case card. It's different if you guys get a case card and there's no priority. Then it doesn't matter where you start from. Okay. But I want you to understand another thing, that there are two ways. First of all, and this is my statement, everything that comes in contact with patients must go through some form of manual cleaning. It doesn't matter what it is. If it comes in contact with patient, there must be some form of manual cleaning. But then the difference is the manual cleaning processes varies based on what you have in your hands at every given time. Does it make sense? There are different types of instrumentations, and the processes is not the same. The process of cleaning one equipment may be different from the other, but they all must go through some form of manual cleaning. It's just that you have to have understanding on how to clean this equipment at every given time. So you get a case card. Case card is filled with items that cannot be submerged in water and items that can be submerged in water. You can't say the fact that you have both items combined in a case card, everything can be submerged in water. Doesn't work like that. So you need to understand instrumentations that are metal like this. Automatically, there's no question. It can be soaked in water for well, of course, based on the manufacturer's instructions. Usually you can soak it for sterile, if you're using sterile detergent, from 2 to 5 minutes. If there's a lot of blood dried on it, then you can soak it over a long time, a little bit longer, so that the blood will be moistened to clean before you can clean them. But anything metal, from now on, you don't have to know how to clean. Well, you know how, I'm going to show you, but then anything metal, you have to understand, you can soak it in water. Does it make sense? Mm-hmm. You can soak, brush, clean, rinse. Anything metal can go in any form of mechanical washer. So after manual cleaning, it goes on to ultrasonic for 15 minutes. If there is a lot of blood, ultrasonic will help break down further before you put them onto the automated washer disinfector. So one instrument like this, depending on using your judgment, depending on the nature of the instrumentation, you may choose to do the manual cleaning, go on to ultrasonic cleaner, which we'll talk about, and then before it goes on to automated washer, because some orthopedic trays becomes very bloody. And the reason why we have all this equipment is to make sure that after manual cleaning and after putting the instrumentation through all the mechanical cleaning, there should be no blood on that instrumentation. You also have to understand that after your manual cleaning is done, your instrumentation should be handled without any fear of having infection, right? Because you have disinfected the instrumentation, right? So the person in prep and pack will not put on PPE to handle the instrumentation that are coming in. All right, I hope I'm not confusing you, but this is important. We are dealing with stainless steel or metal instrumentations. Now, this looks like it's a stainless steel or metal, but this is a camera. Don't put no camera inside a washer. This can be soaked because there's nothing on here that will break if this goes inside water. Okay, but certain equipment like barri, if you soak barri, these are equipment that cannot be submerged. It must be manually cleaned, but cannot be completely submerged. Why? If you submerge this in water, water will force itself through here and it will cause fluid invasion. I'm going to talk about the equipment that cannot be submerged, right? But I want us to understand the stainless steel instrumentation first, and I'm going to show you, I have them here. I'm going to show you equipment that you cannot submerge in water. With time, as you read along, as you work, we come to know more. The way we clean equipment that cannot be submerged in water actually is consistent to almost everything that we do in Beacon. So if you know how to clean one, you know how to clean all. Just that the instrumentation may be different, and there are certain areas that you have to clean on some instrument. For instance, for metal instrumentation like this, right? You can soak everything underwater, but look at the make of this instrumentation. This is wrongdoer, double action wrongdoer, right? This is the name of it. But look, if you don't know to press and open here, do you know that there's a space or there's a hole in here that needs to be cleaned, top and down? Of course, the most important part is this area. That is where they use to chop off excess bone from wherever they are working. So that it should be a focus. You see, there's a hole in there. And that hole needs to be cleaned. Brush. There's a brush that we have. Give me 1 second. These brushes, and remember, brushing must be done underwater. When we are cleaning instrumentation, brushing must be done underwater. So something like this, if I lift this up and identify there's something in here, I need to just put the brush on and bring it down underwater and then brush. And brush this as fast, it doesn't matter. Your goal is to get rid of anything that is blood on the instrumentation, that's it, okay? Instrumentation that have lumens or holes, you have to get a long channel brush to put through. For instance, there are different sizes of brush that we have, and when you're reading chapter 9, you see all of that. Brushes, you push, you get a big size of brush that when you're pushing in, will touch all the surfaces, right? You can't get a very small brush and then go through like that. It means you're not going to clean it properly. Brushes like this, get a heavy brush. If it is a small hole, get a smaller brush. Push it through, make sure it goes all the way. You see how I'm struggling? It's too big. So I have to get a smaller brush because it needs to come all the way out. And I need to do that underwater 3 times to get rid of anything that is inside. When you get instrumentation like this, remember, they can all be submerged, but your goal is making sure everything that have holes is identified and brushed. Because what if you don't brush it, this will go in a washer, and when they get in prep and back, it will be bloody. This is called suction, Yankua suction. Suction is using suctioning fluid and blood during surgery. So of course, you want to pay attention to this, right? Especially if it is not properly cleaned upstairs, point of view care is not done. Then you're gonna have a lot of blood that needs to be taken care of. Now, you look here carefully, you see that something needs to be screwed on. This Yankua suction comes with a tip that needs to be removed. If you don't remove it, you can't put brush all the way through. But it's small that if you don't pay attention, you lose it. Okay, so just so you know. All right, so before we're saying brushing must be done underwater to prevent aerosolization. It's a state board question, okay? This instrumentation here, when you get something like this, and you take it from, this has been taken from the rigid container, right? The rigid container will be loaded onto the car washer. So that part is not, we are not bringing it here, right? But when I get something like this, I want you to know the right thing to do. On the side of this sink is a space. Hold the handle with your gloves and everything. Of course, you have PPE on. This is how you do it. You hold it this way, and then you turn it down. Pour everything on the surface. The sink, if the sink space is not big enough, usually SPD department will have a big table, okay? There will be a table that you can completely pour everything on there. Why do you have to do that? Never put your hand inside bloody tray. Take this from me. Let me see if I can get a video. Never put your hand inside a tray that is bloody. If you do,
gloves.
Yes, but the gloves is not metal, right? Your gloves is plastic. So if you put your hand in, and let's say something is hidden, you can easily get yourself poked through the plastic, through the gloves. So when you have the item spread on a bigger surface, you can clearly see the shafts. You can see what is in there. And then you start organizing. Heavy items goes at the bottom of the basket. You see, heavy items goes at the bottom of the basket. In this case, if I take something from the table, an instrument, and I see that the instrument is bloody, I bring it to the sink, I get rid of whatever blood is on there, then I'll put it in the basket, soaking. But of course, you'll fill your sink, there's a water line right after you open your case card. Let me take you back a little bit. You have your PPE on. You identify the trays to be clean. Scan the tray in your tracking system. Then make sure you turn everything down, pour everything on a bigger space. Fill your sink, fill in with detergent. The sink, there's a water line, there's a detergent pump, you just press and release detergent. Every department should have this detergent pump. One is connected to the soap, one is connected, this is in the sink. So see if I can plug this. I don't make a mess. It's very helpful. Obviously, it's connected to electricity, right? It's a connection there. So every day before you start, press or fill, there's a tap, just turn it on, fill your sink, there'll be a label. The water label is there. So you know how to fill your sink to the water label, and then press the green, because the soap has already been calibrated to fill in the sink, to give you the enough amount of soap that is needed as per how many gallons of water is in the sink, okay? That is not a math that you have to do. It's already programmed for you, okay? The only time you have to know how to calibrate this is, or how to use the measuring cylinder to measure soap is when the detergent pump is broken, okay? 1 ounce of detergent is proportionate to 1 gallon of soap. We don't open bottle of soap and just start pouring it inside the sink. It doesn't work like that. Everything is measured, okay? So things that we do in central service is well calculated, okay? All right. So don't forget, brushing must be done underwater. Make sure you don't take a basket and just soak everything inside the water. Don't do that, right? First of all, if the instrumentation is bloody, then somebody didn't do their work well. It doesn't mean you're not going to clean it. You clean it by your report, right? Clean and report. So let me just open this screen here. I have some things to show you.
Professor, like you said, clean and report. What about if there is a missing item in the cart?
Come again. What about if there is, I missed that part.
There is a missing item. For example, there is a faucet that is missing. And do we need to report it in the system? Or do we need to talk to the supervisor?
Supervisor. A decontamination, unless you really know the instrumentations off your head, unless you know the tray off your head, usually in decon you can identify. There are certain instrumentation that is in the tray that is like few of them. Automatically you know that something is missing. It is like 3 items and 1 is missing. Automatically you know something is missing, right? But when the instrumentation is 150, sometimes it's very hard. Until it gets to prep and pack, the person assembling prep and pack will be the one to identify items that are missing. So in this case, you can report out, or you can wait till you get the rest of the instrumentation in, because it may be in a different tray, unless they threw them out. If it is like it's happening a lot every single day, that instrumentation are getting missing, then it's something that you have to report so that they can address that, right? Let's say the tray comes in, is missing something. You will look for the item to replace it. It comes back the same day, the next day, it's missing again, right? And obviously you want to report situations like that. But it's important you report things so that OR is aware, especially if you can't get a replacement. As you said, if there's no replacement, the item is going to be checked as missing. OR must be aware so that they make a decision whether the instrumentation can be used or not. If cases have to get canceled, it will be canceled, because if the instrumentation missing is critical and it's unavailable, they can book for surgeries. Good question. Okay.
Is it, you know, the item that you show us? If we're missing that screw in the department and that comes with from the operation room, what can we do about that?
Instruments in the, come again, I missed that.
Those little screw, it's really important. Like if we lose that, the item is not good no more.
So instrumentation with screws.
Yes.
So like this is a vaginal speculum. Vaginal speculum here, screw here, for them to be able to work on it. The screw is missing. You have to report that.
Okay.
Right? So this is the screw for the speculum. And so if you get this without this, it means that somebody left it up there.
We're
Right.
talking about the suction. That thing.
Oh, this okay. So the suction tip.
Yeah, you said
The suction tip. If the suction tip is missing, yes, obviously you have to report to that. Yeah. But it could be in a tray. So you have to make sure that you've exhausted all the resources first before you report. If you look elsewhere everywhere and you don't find it, then you have to let them know. Because at the end of the day, without that, it will not be used. Okay.
So we have like a draw something for the missing item. For example, just in case that there is in another case, card.
No, our car doesn't have a drawer for missing item. We will have a spare inventory of instruments. We will have a spare inventory. So if something is missing like this, like the tip, you can actually get a spare tip somewhere. But if there's none, then it needs to be reported. Right.
And that is most very.
That is also important. That is very, very important. That is, if you don't see it, then it needs to be reported. Because what if the suction, the tip of it goes inside the patient, which is highly, well, I wouldn't say never. I never know. But over here, some hospital takes X-ray after every surgery to make sure that nothing stays inside the patient. So it all depends. In a third world country, it can happen. They can have a sponge inside somebody's belly after surgery. But over here, the lawsuits will come. So they are very, very cautious of that. But yes, you still have to make sure you identify just in case it's inside somebody. And it needs to be reported accordingly. This is the eye wash station. I wanted to just take you back a little bit, but I'll come back to what we're talking about. Okay. Look at this. So what is wrong?
The other one is not coming.
The other one is not coming. So on your log, you identify, you write what is wrong. This is the handle. You just press, and then water will start coming out. Okay. So make sure it's clean, make sure it's working. If it's not working, you have to report, because what if something goes on your eye, you come in, one is working. That's why we check this every week and we document date, time, functioning, yes, no, whatever, comments. One, pressure is down or pressure low, and then action plan. Facility has been contacted. Somebody have to put in a work order for this to be resolved. Okay, so eye wash is a decon. I just wanted to show you. Also make sure you don't block the eye wash station for nothing.
It's just ordinary water.
It's just ordinary water. Temperature, you also have to check the temperature, because if it's too cold, then it'll be very, very uncomfortable for you. So I lost all the pictures again. I wanted to show you more pictures. All right. So I hope you have a better understanding here, right? The sink and everything else. The sink, fill your sink with detergent, right? And then wash the instrumentation. Every individual instrumentation must be handled. Of course, if I take an instrumentation like this and I don't see blood, I don't waste time, right? But if I pick an instrumentation and I see that, well, inside the box lock is blood, then I need to get my brush underwater. All instrumentation with box lock, ring handles must be left in an open position like that, okay? Instrumentation that comes together must be disassembled in order to be able to properly clean them. Disassembling is done based on what the manufacturer recommends. The manufacturer will say, if you don't disassemble my vaginal speculum, you may not be able to clean it properly, because there will be blood hidden somewhere that you may not be able to see. That's why we take some instrumentations apart to be able to clean them well. This gentleman or lady is cleaning some instrumentation called laparoscopic instrumentation. Laparoscopic instrumentation are like this. Not all this long instrumentation that were inside the tray shape open. Lap instruments. It comes in 3 pieces, comes in 4 pieces, comes in 2 pieces, depending on what you have. Something like this comes in 2 pieces, the insert is missing. So it's like this. They need this insert. See, this is not the right insert. There's an insert that goes in here before they can use this. When this comes in decon, this insert needs to be removed before you can properly clean this well. Can you imagine if this is in there and you wash this equipment in the sink, this can go in a washer. When somebody in prep and pack receive this and take this apart, you know how the amount of blood that will be in here. You'll be amazed. It means you don't know what you're doing. So some instrumentation must be disassembled. Okay. So again, how do you disassemble instrumentations like this? These ones are tricky. These are old module. So you have only 2 pieces. You open it to take it apart, to take it out. Okay, open the handle. Similarly, if you have to insert something, of course, like this, you have to open it with your hands, right? Open this, and then you insert this. This is not the right insert again, but you open it until you hear a click sound. And then once you hear a click sound, once you do this, you see that this can be open and closing. As you open, it opens from here, the jaw opens, and as you close, it closes from here. This is how they use to grasp on tissues when they are working on patients, right? So if this comes to you in Decon, you need to know equipment like this, it needs to be disassembled before you can clean them. The funny thing about this is there is suction here, but you can't put no brush through here to come out. You cannot. So things like this, we use the water hose, which is on there on the sink. There's a water hose, or this. You use this to fetch some of the detergent solution, and then you connect it. Anytime you can put brush through an instrumentation that is cannulated, you get syringe, connect it with detergent, keep flushing through so you get everything out. Following your manual cleaning, instrumentation like this goes on to ultrasonic cleaners. It is a must. So that's why we're going to talk about ultrasonic cleaners. If we don't do it this week, we'll do it next week. We'll talk about the equipment next week. We should finish decontamination completely by next week. We go on to prep and pack, and we'll start sterilization. And you guys will be watching some couple of videos before we come back again. But I want you to understand this. Equipment that you know that you can put brushes through must be supported by your ultrasonic cleaner. The ultrasonic cleaner is able to go through areas that your hands cannot reach to get rid of any debris. Okay, so after you clean each individual instrument, make sure you're touching every individual instrument, because if you don't touch the instrument, how would you know there's blood in it? So don't do a lazy work, because if you do a lazy work, by the time you realize all your instrumentation on the other side will be bloody, and then we're able to track who processed it, because remember you scan the tray in Decon. When you take the tray from the case card, you scan the tray in the tracking system. Okay, it shows the time the instrument was received in Decon. So at any given time, we will know who decontaminated the instrumentation. So when your instrument comes in bloody, it goes under your name. Right.
You
had a question, right? You have a question?
No, I'm not.
Yeah, awesome. Also, equipments. Again, these are also instrumentation that have holes. Cystoscopy trays, rigid cysto. There are a couple of instrumentation like this. This is called bridge. So what happens is they open the bridge, when the bridge opens, water flows. So the water can flow. When the surgeon don't need water to flow in, they close the bridge. If you get instrumentation like this in decontamination, you have to be aware that if the bridges are up like this, it's closed. You can't put anything through. Let me give you an example. I can't push brushes through because the bridge is closed. I'm showing you this because there are countless of instrumentation that looks similar. And you have to open the bridge by just pressing it down, and now brushes can go through to clean it. And then you put a bigger brush here because the hole here is big. So in situations like this, you get a big brush like that. In this case, this brush, You clean it this way underwater, right? You do this. If it is bloody, white brush will change color. So you know it's bloody, so you pay attention to it. Rinse it off if it is bloody underwater like this, or just use your glove to remove it, pull it back through, because you can't pull, if I push blood out, I can't pull it back in without cleaning the blood of it. You are recontaminating the equipment. So always make sure when you push a brush through a cannulated item and you see blood, rinse it off before you pull the brush out. Do that like 3 times to make sure you get rid of everything. Okay. Any questions on manual cleaning? Yes, sir.
Before you go to the designated place for the trays, is it the same person to do the washing who bring the tray?
Before you
Do we have one specific person who goes to bring, because you have to put on PPE?
so depends on the facility. Depends on how they have their workflow. Sometimes the person in decontamination will be the same person. If there's nothing to be done, then before you start, you go to OR, bring what is there first before you put on your PPE. But some may have somebody dedicated for transport. So if you're in decon, you'll not be the one transporting. Most importantly, you also have to understand, even if you have a double waiter, there's nobody transporting nothing. OR will push it in the elevator comes down. So you are already in PPE, open the elevator, bring your case card and start cleaning. So it all depends on place you'll be working and the systems they have in place, right?
To adjust.
To adjust.
Within the decontamination department, technicians will wear appropriate personal protective equipment, or PPE, as a safety precaution. The PPE will minimize a technician's potential exposure to infectious microorganisms. The process begins by sorting and inspecting instruments. Sorting ensures sharp and delicate instruments are placed to prevent damage to instruments and injury to employees, and enables the technician to identify the appropriate modality for cleaning. During the inspection process, some instruments may need to be disassembled to ensure proper cleaning take place. Because of this, decontamination technicians must be knowledgeable on how the instrument operates and is disassembled. Cleaning instructions are provided by the manufacturer of the instrument. Once the instrument is inspected and, if necessary, disassembled, instruments are placed in baskets to ensure maximum exposure to the selected cleaning method. Cleaning can be performed either manually or mechanically. Let's first take a look at the manual cleaning process.
Sorry. Okay. Let's talk about this, just discuss PPE, right? Importance of PPE. I also have not forgotten, although I just showed you equipment, like the stainless steel equipment and how the cleaning is done. I've not forgotten to show you equipment that cannot be submerged underwater. It is very, very important. So when at every given time, you as a professional will have to use your judgment, right? Whenever you receive instrumentation in a container, you will look at it and see whether everything can be submerged underwater, or there are some equipment that cannot be submerged underwater. Some trays have both mixed together. Some trays may have everything that cannot be submerged underwater, or may have some few that can be submerged, some cannot be submerged. Always use your judgment. Again, once I show you the instrumentation and the areas that are vulnerable, you'll be able to identify anytime you see a tray or an instrument, there is something on it that is unique, that will enable you to know, okay, I can submerge this part underwater. Okay, it means you have to clean it, but those areas on the instrumentation must be removed must stay outside of water, because if water goes through there, it will cause fluid invasion and the equipment will be damaged, okay?
A hospital's decision to manually clean an item may be based on different factors. These factors can include recommendations from the manufacturer of the surgical instrument, not having a mechanical system in the department, manually cleaning prior to the mechanical process, delicate instruments not able to withstand mechanical cleaning, or powered equipment that cannot be processed in a mechanical washer.
Okay. Power equipment.